Welcome back. We are with Morgan Campbell and Catherine CVA answering your questions about healthcare enrollment and Medicare enrollment as well. All right, this person says, if you enroll in a Medicare Advantage policy, can you ever go back to a regular Medicare and a supplemental policy?
You can, if you initially turn 65 and you select to enroll in a Medicare Advantage plan. And then after a year, when we go back into open enrollment and you decide that Medicare Advantage plan is not for you, you can bypass underwriting with the Medicare supplement one time in your life, and then you can switch back.
Okay, but Catherine, I know both of you, we were all talking about this. You only get one free pass, right?
That's right. And so it's not a situation where you want to be making that change as part of your daily work or your annual work.
Okay. All right. This person is asking, when you are a state retiree from the school system, can you change your plan without a penalty?
The state plan has a multitude of options. I don't know of any penalty that would be in there. If you choose to opt out of that retirement benefit, I would talk to my HR department. Make sure you fully understand what you're giving up. And if you do choose to do that, then you can enroll in any Medicare Advantage plan or Medicare Supplement and Part B plan that you wish.
Sounds like they're giving up a lot more than what maybe they are thinking. Okay.
Yes.
Catherine, this person is saying, how much more will we have to pay for Medicare in 2022?
We don't know yet. We will hear that probably within the next month, about the same time that they announce the Social Security cost of living adjustment.
Okay. This person's asking, my daughter comes off my insurance mid-2022. She's 26 years old. Can she enroll then due to a change of life?
Yes, because she lost coverage by aging off of her parents' plan. That opens up a special election period. She can absolutely pick up her own plan.
And with that said, she'll be having to pick up her own plan in the middle. Is it something where she should try and get an idea of what the plans are now while everyone else is doing the same thing with enrollment, or should she wait until maybe after January to take a look at that?
I would wait till after January when everything is settled down and we know exactly what the landscape of the market looks like.
Okay. Gotcha. All right, this person says, I'm going to turn 65 in May of 2022. Right now, I am on another health care plan. I was told Social Security, and she says, because I'm already on Social Security, will send out a packet around February when I can sign up. Is that true?
Yes, it is.
Okay, this is good. Everybody says, yes, it is. So you will be getting that packet in February. All right, this person says, I'm 32, and they sent me a Medicare card instead of Medicaid by accident. Who should I contact to get the correct coverage?
So just to make sure that this person does not have Medicare due to disability, I would double check that. And if that is not the case, then I would contact Social Security, and I would also contact the Medicaid office in the county in which they reside.
All right, this is always the sticky question. I plan to keep my work insurance as I hit 65. When I sign up for Medicare as required, I only sign up for Part A, correct? I would add Part B when I no longer have employer coverage. Let's make sure this is clear.
Yes, you can choose to do that, but before you do, you need to talk with your HR department to make sure it is a qualified plan that Medicare will recognize, so that you don't get stuck with the penalty for not having signed up for Part B if you should have.
And so is it one of the things that you sign up for Part A and Part B and then you say, while I have signed up for both, I am putting off Part B? Is that how that works?
Yes.
Okay, and so we want to make that very clear. So you have to sign up for both, and then you have to then put one on pause when you decide that that is what you're going to do and keep your regular work. Okay. This person is saying, if you're on Social Security disability and you're going to be 65 in December, what do you need to do?
Really nothing. If you're already enrolled in a plan and you're happy with it, you still want to look at the options, compare the options that are going to be out there and select the best one suited for you.
But they're on disability, so do they need to sign up for Medicare?
It should automatically be given to them.
Medicare and Medicaid?
just Medicare Part A and B.
I see. Okay. All right. Got it. All
But
right.
if
Thank
they
you so
want a
much.
But if they want a supplemental plan, they still have the option to look at that.
Okay, and
Yes.
sign up through Medicare. All right. We appreciate all of your questions today. Everything, including the dates for the enrollment, are in the 2 Wants to Know section.